Hello and welcome to the final video in the Cedars-Sinai spine surgery series. In the previous videos, we covered preparing for and what to expect during your hospital stay and surgery. Taking good care of yourself in the weeks following surgery can be beneficial to your overall outcome, and that's what we'll discuss in this video. Also, please remember, if anything you hear during this video contradicts directions given by your surgeon, please follow your surgeon's specific guidelines. First off, let's discuss discharge from the hospital. To help ensure you have everything you need when you're back at home, medical staff will assist with discharge planning during your hospital stay. This planning could include ordering special medical equipment for home use, as well as arranging for a home caregiver for extra assistance. Patients usually go home directly from the hospital. However, sometimes a surgeon or physical therapist may suggest a stay in a rehabilitation unit. This could be at Cedars-Sinai or an outside facility close to your home. If it hasn't already been scheduled prior to surgery, call your surgeon's office to set up your first follow-up visit. These appointments are scheduled typically 10 to 14 days after surgery, but sometimes up to 4 weeks. Also, for your car ride home from the hospital, I recommend using pillows with the passenger seat down or lying down in the back seat for comfort. Remember, no matter what position, you must wear your seatbelt. Regarding pain management at home, you most likely will be discharged from the hospital with pain medications. Pain medications, specifically narcotics, can cause constipation, so drink plenty of fluids, take stool softeners, and increase your fiber intake by eating more fruits and vegetables. Any of the medications that you were taking prior to your surgery may affect the healing process after surgery, so ask your surgeon when you can resume taking these medications. Please also make sure to ask your surgeon how long you should avoid non-steroidal anti-inflammatory medications. These can affect your recovery. After surgery, while in the hospital, you might have to wait until your surgeon allows you to eat. Once you're okay to eat, you will likely start with clear liquids such as broth, water, jello, tea, and then increase to a regular diet. At home, it may be beneficial to stick to a soft diet rich in vitamins and nutrients, as long as it's cleared by your surgeon. Ask your surgeon or physician assistant if it is okay to take a shower during the first week after surgery. Also, it's recommended that you don't soak in a tub for at least 3 weeks after surgery. Please be safe while in the shower. A shower chair may be helpful for the first few months after your operation if you had a lumbar fusion. Finally, make sure your shower has a non-slip floor or floor mat. Some patients find it beneficial to have a shower handle, which can be arranged prior to discharge. Be a patient while your body's healing. It's natural to feel weak and tired after surgery. Everyone's recovery is different. Please do not rush the healing process by returning to work or normal activities too soon. On that note, let's discuss how much activity you can actually do. First, no bending, lifting, or twisting. Driving is typically cleared 2 to 3 weeks after surgery, as long as you are off narcotics and antispasmodics. Walking is definitely the cornerstone exercise for healing. However, you should use common sense and check with your surgeon about how much you should be doing on a daily basis. Ask your surgeon before engaging in more strenuous activities, which include housework, yard work, manual labor, jogging, cardio, bike riding, swimming, sexual activity. Now, here are a few tips to keep you safe and comfortable. Sit in a reclining position with good support under the lower back. Bend at your knees to pick up objects that are lower than your body. Do not pick up anything heavier than 5 pounds unless instructed to do so by your surgeon. When turning, turn your whole body rather than just your neck or lower back. Do not twist at the waist. If your surgeon orders a collar or brace, wear it as discussed. It's also important to protect your body while sleeping. Here are some rules of thumb. After lumbar surgery, sleep on your side or on your back. You may find it helpful to place a pillow under your knees when sleeping, on your back, or between your legs when lying on your side. After cervical surgery, sleep in the neck collar if your surgeon recommends it. Sleeping in a reclining position for the first 1 to 2 weeks may also help. You can sleep on your back or side, but best not to sleep on your stomach. If you have problems sleeping, your surgeon may prescribe a light sleep aid to use during the first few weeks after surgery. Do not be surprised if you're sleepy during the day. Pain medications and the stress of surgery make most people tired. Always listen to your body. If you're tired, rest. Get clearance from your surgeon when to resume sexual activity. Typically, we say 3 to 4 weeks. If you feel pain during sexual relations, please stop. It's very important to continue with good and healthy habits, so please do not continue or start smoking after surgery. Also, a healthy weight is important before and after your procedure. If you're currently overweight or gain weight, your surgical outcome could be at risk. Following the guidelines we just discussed will help keep you safe and healthy after surgery. However, emergencies do happen, and knowing what to do should one occur can be of great benefit to you and those around you. Call 911 or have someone take you to the nearest emergency department if you experience chest pain, shortness of breath or difficulty breathing, and/or severe abdominal pain. Call your surgeon's office if you have a fever above 100.7 degrees Fahrenheit or a low-grade fever that lasts more than 5 days, drainage, redness, or swelling at the incision site, your dressing or bandage is soaked from drainage within 6 hours, your incision smells bad, any open areas in the incision, changes in bowel or bladder function such as an inability to urinate or have a bowel movement, severe pain that is not controlled with medications, pain, swelling, redness, or weakness in one or both legs, and shortness of breath. I hope these videos have helped inform you about what to expect from surgery. Your attitude and a positive approach to your care will help lead to a faster and better recovery. So thanks for watching and for choosing Cedars-Sinai Spine Center. We look forward to your successful recovery.